What can you do to boost your chances of passing the NCMHCE? Only about 50% of candidates pass the exam each year, so you should make sure that you're prepared for test day. Today we're going to cover exactly what you can expect from the NCMHCE and go over some helpful resources to give you a head start on your counseling journey. Let's get started. The NCMHCE consists of 11 counseling cases designed to evaluate your capability to make clinical decisions pertaining to figurative mental health clients that you may encounter in real-world situations. Each case will include one narrative and 9 to 15 multiple-choice questions. The exam is split into 3 parts. Component 1, Intake. This part of the exam provides you with basic introductory client information such as how old they are, whether they're male or female, and what problems they're presenting with. You'll also be given the setting as well as the presenting concerns and diagnosis of the client. Component 2, Clinical Session 1. In this part of the exam, you'll work on the presenting concerns with the client by using evidence-based approaches. Things like conducting a biophysical interview, determining the level of care needed, assessing for trauma, evaluating counseling effectiveness, conducting an initial interview, and more. Component 3, Clinical Session 2. In this part of the exam, you'll simply be continuing the work that you began in the last component. In total, the NCMHCE contains between 130 and 150 questions and has a time limit of 255 minutes, or 4 hours and 15 minutes. The questions on the exam cover the following 5 content domains. 1. Professional practice and ethics, which is 10% to 20%. 2. Intake, assessment, and diagnosis, which is 20% to 30%. 3. Treatment planning, which is 10% to 20%. 4. Counseling skills and interventions, which is 25% to 35%. And 5. Core counseling attributes, which is 10% to 20%. When it comes to taking your test, be sure to bring 2 separate forms of current valid ID. Both of these must have your signature and the same first and last names as they appear on your certification eligibility notification, but only one is required to have a photo. If you prepared for the NCMHCE exam by taking a practice exam, you should be familiar with the examination screen, which includes 2 windows. The scenario window on the left side of the screen displays the simulation you're currently working on. The options window on the right side of the screen displays the section you're currently working in. And this window will also include instructions such as how many responses you are to choose. Once you've submitted a response, you cannot unselect it, as your submission reveals information about that selection. To review previous sections and feedback for responses, go to the top right-hand portion of your testing screen. Here you'll be able to view a review screen of your progress on the current case. Upon successful completion of the examination, you will receive an unofficial score report from the exam proctor, which will indicate a pass or fail. Passing scores will be sent to your state licensure board within 30 days. If you do not pass the exam, you may take it again after a 3-month waiting period. Now, whether you're taking the NCMHCE for the first time or the 3rd time, it's best to be as prepared as you can be. In addition to this exam overview, Mometrics offers several different options to help you get the score you need to pass your exam. We have an NCMHCE exam prep study guide featuring 2 full-length practice tests. We also have NCMHCE flashcards, and you'll get over 500 flashcards covering every subject on the outline. And last but not least, we have an NCMHCE online course that takes all of our prep and bundles it into a digital format. No matter which route you choose, we can't wait to help you get your best score. I hope this review was helpful. Thanks for watching and happy studying.